Good morning, everyone. Thanks for joining us. I hope the conference has been great so far. So I'm going to kick this off and then hand it to my colleagues. My name is John Pearlman. I'm an associate professor at Pitt and the chair of the department, and have had the pleasure of being part of the leadership team of ISWP for, I think, approaching 8 years. And as I announced at kind of the opening session, we've hired Alex Kamadu to lead this separate entity that we spun off. And so today is really about talking about the resources that we've developed that are available, that we want you to not only adopt and adapt to your own environment, but also provide feedback on. So it's a pleasure to start this off. In terms of the agenda, we have just 10 minutes of an introduction and an icebreaker, and then we will go into the overview and activities. So we're going to split into, this is the first time I've seen these slides, so I'm going to barrel through this as if I know them, and my team is going to give me some support as needed. So we're going to split into 3 groups. If you're brand new to ISWP, if you're on the distribution list but not involved much, and then if you've participated, and we're asking you to stand up and move around the room into 3 corners, into those categories. So I will say, Nancy's in category 1, you're brand new. Let's go to the back. Group 2, you're on the distribution list, and 3 over here if you participated. And say hello to each other, meet each other if you don't know each other. So group 2 is in the back, you're on the distribution list, but you haven't participated much. And group 3 is over in that corner. You've participated in ISWP working groups and activities. Great. Now that the ice is broken, here are the learning objectives for this session: to describe at least 3 resources available through ISWP, and 1 opportunity for engagement, and identify gaps in our tools and resources and provide recommendations. So that's more of, rather than a learning objective, that 3rd one is more what we're asking from you, is to help identify that and give us feedback. So as I mentioned, this has been a project that's been in place for many years and headquartered here at Pitt, but has really leveraged and worked with people all over the world, and has activities all over the world. And it was founded because of an enormous unmet need, right? So the wheelchair users globally have very little access to wheelchairs, and it's because many reasons, but I think the primary one is that their healthcare systems don't provide a benefit to access a wheelchair. And that need has led to a lot of, not enough, but a lot of different donors trying to support that activity. And they've done that in many different ways over the past several decades. And it hasn't been very well coordinated. And so the WHO has especially been involved in trying to drive that coordination. And one of the ways that the WHO has done that is through activities internal to that organization. Then donors who have subscribed to this idea of needing better coordination have also funded different initiatives. And one of them is ISWP. So I would say I think the landmark sort of shift in the field in the wheelchair sector is up on the top left, when the WHO published this joint position paper on the provision of devices in less resource settings, identified this real challenge globally, and helped to drive and set the wheelchair sector, on a different path. So one of the major issues with the different approaches to wheelchair provision is that it's not always that something is better than nothing. In many cases, wheelchairs can, if they're not provided, and I'm sort of preaching to the choir here, but if they're not appropriately fitted and there's not enough knowledge of the provider to really formally assess the individual, or there's no assessment at all, which is commonplace still, that the issues are that it can hurt somebody. It can cause a flexible deformity to become fixed. It can lead to a pressure injury. And many of the initial, and they still frankly continue to go on this way, many of the initial goals have been about the numbers of wheelchairs provided, not what it has done and provided support for the individual or empowered the individual to be independent. So the outcome measure has been, for those, sort of the goals have been 1 million wheelchairs by this year. And so what that does is it drives an incentive to lower the cost of wheelchairs, right, to find the cheapest chair, and to reduce the actual cost of delivery, which is often, here's 100 chairs, self-select which ones that you want. And that has, as you can imagine, caused tremendous trouble. Sometimes the dynamic's really challenging because a country who may see the need to develop a benefit for wheelchair users in that country now say, well, we don't need to do that because we have somebody coming in, and they're not aware really of the proper approach to doing it. So it actually can stifle the sector progress. And so this was known by, I think many groups, seeing some groups would set up a service that had sort of a clinical assessment and delivering, and then they'd see an organization come in and distribute 1,000 wheelchairs, and that service then has no, actual operation. So there was just a lot of trouble in the sector. And so the WHO saw that, and many organizations that had identified this as an issue banded together and work with the WHO, who is really just a coordinating body for groups with like-minded issues in the health sector. And through that process, USAID primarily, so US taxpayer funds, have been a massive driver of these initiatives. Just as we're in the US, I want to make you all aware of this. It's a global initiative largely funded through USAID, drove the WHO and to publish several documents which have set the trajectory very differently. It hasn't stopped groups from just distributing wheelchairs, but it's set a different trajectory. A landmark publication was in 2008. It took 2 years to generate this publication, which are the guidelines on the provision of manual wheelchairs in less resource settings. I was part of the development of that, and I would say we spent 4 or 5 days in a room like this, but in Bangalore, India, arguing about the definition for an appropriate wheelchair, right? So we kind of ground through what everybody felt like was the most appropriate wheelchair and how you describe that and define that. And then after 2008, which is really sort of a guideline, right? It's a roadmap. It's not something you can bring to a country and use to really change how provision's done, led to a series of other publications, which were very much implementation, right? How do you train somebody to provide appropriate wheelchairs? How do you train somebody to manage a service? How do you train somebody to train somebody, right? The trainer of trainers. So these are all sort of the stepping stones to building the training apparatus to build a workforce globally. And WHO published these. And so one of the initiatives, right, is you generate all these publications. Now, how are they going to get used? Who is going to actually be the coordinating body to make sure that they're adopted by all these organizations that are largely, funded by a foundation that has an interest because a family member used a wheelchair? So there's a lot of that going on, and the vast majority of funding is coming from small donors that are pooled in different ways. So that sparked a couple of changes in the sector and investments by USAID. One was ISWP. So we were supported to help coordinate the sector. And there's a couple other activities. One is in WHO, they coordinated GATE, which is really all focused on AT. And the third one is a wheelchair supply scheme that's run out of Momentum Wheels. They changed their name a couple years ago. But that basically takes, it solves a real issue, which is if you want to bring in wheelchairs that fit the population, you really need to bring in low-cost wheelchairs that are high quality, but it's a blend of different wheelchairs because you have a blend of different people that have different needs. And so CLASP operates a coordinating center that takes different wheelchairs that are manufactured in Asia primarily, puts them in a container and ships them all over the world. So it's a distribution scheme. And so, that sparked the development of ISWP back in 2015, which was at its core focused on developing, coordinating the sector. And I would say, focused on a couple of different pillars, all about driving the quality of wheelchair services and products. So services and products are the pillars. To do that, you have to advocate for countries to require service providers to be qualified. You have to build a training network and a trainer network to actually build the workforce to do it. So it's always nice to say we focus on these different two pillars, but ultimately there's a lot of mechanics behind that. There's a lot of organizations and governments that you have to engage to try to get behind those things. And so, that led to many years of funding for us to help drive that. And then ultimately the goal is to set up a separate entity. So it's not just linked to Pitt anymore. It was really incubated in Pitt. We started this company, it's a nonprofit, and helped secure funding into that nonprofit, which was awarded earlier this year, and then hire an executive director to lead it. So that has been, a much longer process than I think anybody would have assumed. And the process even to separate from the university was to set up a founding board that would help define what the initiatives are, what the process actually, so it's sort of planning to plan to set this up. And so the next steps are what you see on the screen. And I think at this point, I'm going to bring up the next speaker. Is it Alex that's coming up? Nancy's coming up to talk about this sort of process of moving out of the university. So thank you all for attending again. I encourage you, and it's great to see the folks that were over here that are already deeply engaged, but what we want to do is have the larger group over here that are new to this, that are interested in this, to engage and participate and again, adapt and adopt and give us feedback on the materials that we're going to present today. So thank you again.
Hi, everyone. For those of you whom I haven't met yet, excuse me, I'm Nancy Augustine. I'm the ISWP project manager. I am not a clinician, I'm a business person, and I was hired into the university when we received the first USAID grant. With my business background, I've been helping with the infrastructure and managing the grant, and now part of the team that's led to the rollout of the separate entity. So I have colleagues here today who can certainly assist me in any questions you might have from the clinical side. But this is our advisory board and our founding board. So we initially had an advisory board of about 18 members. And as part of the separate entity infrastructure, we created a founding board. Some of those members transitioned, some were new. But these are logos of just a sampling of the many organizations that we partner with and around the world and provide important input on our programs and services and the direction for the organization moving forward. So ISWP's focus, I'll switch around a little bit. Our focus is advocacy, training, and education and product standards. You heard John mention the 2 pillars, training and education and product standards. There is a 3rd pillar. I think we all do this, and that's advocating for clients, for policy changes, and for the need for appropriate products and services. Underlying all of this is evidence-based practice. We know that we need to have the latest evidence to prove the need for these products and services and to justify them. So these are activities in a nutshell. I know that's a little small to read, but it gives you a sense of the scope, and I'll be talking about some of these activities this morning. So ISWP focuses our efforts on WHO's 5 Ps model for AT system strengthening. And as you can see here, the focus of this model is our people, the wheelchair users, who we always have to keep as our priority. Around our people, we have policy, products, personnel, and provision. And surrounding those are the Convention of the Rights of People with Disabilities, universal healthcare coverage, and the UN Sustainable Development Goals. But we always keep our focus on the end user. So ISWP resources are all related and built upon these 5 Ps. We have products, and our first P, product, involves our product testing. So thankfully, with the USAID grant, we were given the opportunity to build a lot of product testing equipment at the University of Pittsburgh. So if you can see here on the left, this is actually caster testing equipment that was built by a student at the university. And we have been testing casters both internally and for manufacturers. And we're very pleased that the result of this work is the first ever ISO International Caster Standard that took about 3 years to develop, but was launched in 2021. Next, you'll see corrosion testing. We have a piece of equipment at the university that you can put an entire wheelchair or wheelchair components in what we call a salt fog chamber, and you can vary the environmental elements to determine how quickly a wheelchair or wheelchair components will rust or deteriorate. So we're trying to mimic the conditions that a wheelchair experiences in the real environment. We have done bushings testing, which is showing the efficacy of using bearings versus bushings, and we have a recent study published on that. We also have built rolling resistance testing to show how difficult it is for a person to navigate a wheelchair based on tires, casters, and toe in and toe out. And we have really enjoyed our collaboration with LeTourneau University as those students built a rolling resistance test equipment, and Free Wheelchair Mission, which has developed a really unique whole wheelchair test track. So it can accommodate 4 or 6 wheelchairs, and it rotates on a track, and they test different conditions over certain periods of time. So we are very fortunate to now have equipment to test products in less resourced environments. Through our product testing and all of this knowledge we've gained, we have created a product testing wiki, which is a collection of resources that include open access test drawings that test labs can use for double drum, rolling resistance, caster testing, so that a test lab doesn't have to start from scratch. They actually have drawings that have been created. Stephanie Vasquez oversees our product wiki. She's here in the front row. Does a great job working with a group of people to continue to update this with the latest information on testing best practices. It's part of our website. And interestingly, when we look at the Google Analytics, it is among the top 10 website pages that are accessed on the site. So we're very proud of that resource, and it is there for you for free of charge. All of this great product testing and all of the great experts around the world who work on product testing participate in the Wheelchair Standards Community of Practice. And you can see here that the objectives are just to really have a forum where people can meet quarterly and discuss the best practices for testing wheelchairs in less resourced environments, as well as to provide information and support to each other. These are very engaging and interactive quarterly meetings where people are exchanging ideas and helping to solve problems and even trying to come up with new product designs for wheelchairs in less resourced environments. Among the group, we have 15 testing centers around the world, and this is a map that you'll see on the product wiki. This is not all of the testing centers, but gives you an idea. You can click and see where each testing center is. And if you would like to get in contact with one of those testing centers, there's contact information provided. So these folks are very interested in collaborating and working together. And if you're interested in the standards community of practice, see Stephanie, or her email address is there. Our second P is policy, and we have created the Policy Advocacy Toolkit. It is a resource for stakeholders to use when you know that you need to advocate at a higher government or Ministry of Health level for appropriate wheelchairs and services. So it helps you think about the process. So it helps you to understand the current wheelchair situation in country. It helps you map that out. And you can also prioritize where you want to focus your attention in those meetings with stakeholders. So it can be used by anyone. And the target audience for this information are ministries of health or development partners or governments or civil societies, where we need to convince them to change the policies related to appropriate wheelchairs and services. That is available on our website, and it is a free resource. Any questions so far? Feel free to ask questions at any time. An outcome of our advocacy work as part of our ongoing advocacy work is some legislation that was enacted in Colombia. Thanks to Sarah Munera, sitting in the back, ISWP's technical advisor, Perry Lowe with Lowe Medical, and a consortium of manufacturers. They approached the Colombian government and were successful in having the Colombian government enact legislation on wheelchair service. So the new legislation requires that each company manufacturing or importing wheelchairs needs to have a technical director who is certified by ISWP. And you heard Alex talk about the certification program yesterday, but the certification is an important foundation to show that that person has knowledge of appropriate wheelchair service provision. The government also is creating different roles, and within those roles, those providers also have to be certified. So it is providing a framework of knowledgeable providers at the manufacturing and the provision level. And we see this as a model for other countries moving forward. Our third P is provision. And as you heard John mention, in 2008, WHO launched the wheelchair guidelines. And we are very pleased to be working with WHO and ISPO to update those guidelines. And they're going to be launched at the ISPO World Congress in a couple of weeks. So ISWP actually supported one of the two co-authors, Rachel Cowan from the University of Alabama, Birmingham, and ISPO supported Sarah Sheldon, the WHO consultant. We worked with Kylie Shea, who works at WHO. But there was also 4 working groups of people who worked for another 2 years. As John mentioned, the first guidelines took about 2 years. This work has been 2 years in development. But we're really excited to see those guidelines and continue to promote those guidelines after ISPO. So I'm sure we'll be holding webinars and keeping you informed through our newsletter and social media channels about those. Our fourth P is personnel. And we have a number of resources available to train personnel in wheelchair service provision. Any questions? Okay. John also mentioned the development of the courses from WHO on wheelchair service training and provision. ISWP has actually taken those courses and moved them into online modules. So if we start at the beginning, we have the wheelchair service training package basic. And thanks to the underwriting of Latter-day Saint Charities and American Wheelchair Mission, we were able to support the development of the basic modules. We also have had follow-on funding to have the modules translated into additional languages. Our most recent languages based on need in the field are Urdu, Ukrainian, and Lao. So those have been funded by donors to support trainings that are taking place in those countries. If we move out from basic, you can see that we also have created training of trainers online modules at the basic and intermediate level. And we also have a managers and stakeholders package. And what we have found through the research leading up to the launch of these modules, it's that they significantly reduce the amount of in-person training that takes place, which means that clinicians have to be out of the lab or the clinic less. It also saves money. And we have found that it is enabling a larger pool of individuals to be trained. So we have seen the success of these online modules. And I can tell you that it was especially important during COVID because people couldn't train in person. And we did a training in the Dominican Republic, and Silvana is not here today, but Silvana was one of our trainers. And it was fascinating to see how these trainees were able to overcome the odds of not being able to be in a clinic, but use that time productively by doing the online training. And that training was actually supported by the government in the Dominican Republic and the Pan American Health Organization. So we are here to support training efforts through these organizations and others. The courses are available and you can take them at any time. And then in the basic wheelchair training package, there is a basic test that can accompany the training. So we have some feedback from one of our training participants. Bear with me, we have to exit out of the show. The high technology does not allow us to do this easily.
Hola, muy buenos días. Mi nombre es Luis López, soy fisioterapeuta. Un agradecimiento a ISWP por habernos invitado a este curso básico de silla de ruedas y también a OPSI por permitirnos estar acá. Hemos terminado el curso. El amplio conocimiento que hemos aprendido ha sido gratificante porque como fisioterapeuta muchas veces nosotros pensamos que los pacientes los pacientes con discapacidad llegan y nada más es de moverlos y no le damos la importancia que es el tiempo que ellos pasan en la silla de ruedas. Gracias al conocimiento que hemos adquirido, se ha modificado nuestro pensamiento y sabemos que no solamente estamos atendiendo pacientes, sino usuarios de silla de ruedas. Muchas gracias por todo el conocimiento brindado y desde ahora vamos a ser mejores en todo lo que hagamos.
Hey, you get to see all my notes. Let's try this again. I had the wrong section. There we go. Okay. So it was really interesting to hear what he had to say about the fact that, physical therapists, many of you focus on exercise and range of motion and didn't spend much time thinking about the amount of time a person spends in a wheelchair and how important that is. So I believe Sarah led that training. We do have some trainers, if you are working with an organization that needs training support and wants to take advantage of these modules, we have supported several organizations in their training efforts. Another really neat group, and I think COVID, if there's any silver lining in COVID, is that we have this technology where we can connect with each other around the world more efficiently and effectively. So we have created our academic training partners. This is an outcome of one of our subcommittees, which is the integration subcommittee. Its focus is to integrate wheelchair service education into the curricula of universities and training programs for PT, OT, and P&O. We now have 33 academic partners from 24 countries, and you can see that it's really well distributed. There are some training programs in here, but most of them are universities that offer academic programs in PT, OT, and P&O. And we usually have a guest speaker who will present on some of the barriers and challenges that that person encountered in incorporating wheelchair service education into the curriculum. And then it usually ends in a really robust group discussion of how we learn from each other. These presentations are archived on ISWP's YouTube channel. So at any time you can click on our YouTube channel and watch the recordings from different sessions. But you can see the representation worldwide. So we say that ideas lead to opportunities, and thankfully they also lead to implementation. The integration subcommittee and the academic training partners' findings and learnings and collaboration have resulted in a new wheelchair educators package. You've heard Alex talk about it throughout the conference. It was just launched at the WFOT World Congress in August in Paris. It is the result of a dedicated, very dedicated group, all volunteers, 29 people, 7 working groups. Some people served on more than one working group. Again, another silver lining to COVID. This started in July 2020. We were all in lockdown. Many clinicians couldn't practice. We were all struggling to find what we could continue to do to make a difference. And so I don't think the timing could have been any more perfect to get this project up and running. It was led by Paula Rushton at Dalhousie University. She's now at Dalhousie University, but then was at University of Montreal. So it was a really wonderful group of people that had a lot of input and a lot of resources to share. And that's what we were finding. We all were doing things and finding that sometimes we needed resources that we didn't know where to go. So we now have a single source resource compendium for wheelchair educators. This is just the screenshot of the first page, and you can see here the URL, and I think the QR code here can take you to the educators package itself and also can take you to a demo of how to use it. So you'll see that each section of the package has an introductory video and really guides you through the stages of integration for PT, P&O, and OT. And our goal is really to really help guide the integration of this into wheelchair service training programs curricula. So I'd like to play for you some feedback from Penny Chang at the University of Philippines. She is the chair of the OT department there. And the University of Philippines was one of the 3 pilot sites that tested the wheelchair educators package before it launched. I'm doing this without my glasses on, so bear with me. It's a little bit of a little harder to see.
Manila.
There we go.
I've been doing wheelchair service provision and training in my country since 2017. What I found very helpful with the wheelchair educators package was the enormous amount of resources available on the website. These were not just placed there, but they were meticulously chosen to help each educator access important information that will help us with our lectures and laboratory sessions. For a faculty member in a developing country, this gives me a wealth of information that had already been appraised, and I do not have to spend so much time searching through various databases. Those with connectivity issues will really appreciate that these resources are available and downloadable at any given time. What I also found helpful was that I was able to see sample lectures and checklists that other faculty members have made. This gave me a sense of satisfaction, knowing that I am aligned and share the same standards as those with other countries. Thank you.
And for a software update, of course. So it was a pleasure to work with the pilot sites. We had a PT program an OT program and a P&O program, and one each in a low, middle, and high resource country. So we represented as best we could the different settings where the wheelchair educators package can be used. And we are continuing to update that with resources. So if you would like to contribute resources, please contact us. But part of our activity today will be for you to take a look at the educators package and provide your feedback. Back to the stackable credential certification. We have a professional standards board. I'm mentioning all of these committees: integration subcommittee, wheelchair educators package, the groups to develop the guidelines. These are all volunteers from around the world who are passionate about wheelchair service and provision. And we have been very grateful for their time and talent to put toward these new initiatives and these very important and positive outcomes. The Professional Standards Board is a group of clinicians and academic researchers and people in the manufacturing community who help to guide the development of the ISWP certification program. And we were very pleased that in 2019, we launched the basic certification. And the benefits of this certification are to raise the global awareness of the need for educated wheelchair service providers and to have professional standards in wheeled seating and mobility. The benefits are twofold to employers and to employees. The benefit to employers is that an employer knows that the company is hiring a person who has the knowledge in appropriate wheelchair service and provision. And there are several steps to get the certificate. You need to pass the ISWP basic test. You need to take an online course in ethics and professionalism and pass a test. And you have to submit the requirements with regard to number of hours of training and letters of recommendation from an employer or a professor at a university. So an employer knows that this person has gone through this formal process to receive the certification. It's also attractive to an employee. Many clinicians are searching, some are required through their profession to do continuing education and professional development. But for clinicians in less resource countries, they may not have those opportunities. So ISWP provides these continuing education opportunities. We have a regular webinar series that we hold. We also have a newsletter for certified providers, and we provide resources for them because they need to be recertified every 2 years. So we want to continue to give them the information they need in order to gain not only their certification, but also their recertification. So we're very pleased that since the 2019 launch, you can see here, we have 150 certified providers from 26 countries. It is fee-based, but we have created the fees based on the World Bank income classifications and strive to keep those fees as low as possible. In some cases, we will do a bulk rate. If a university or a training program wants to bring in a large group, we will work with them to be sure that they can afford the certification. Building on the success of the basic certification, we launched the intermediate and the trainer certificates in 2022. So while those are new programs just launched last year, we're really excited and hope to see the same level of adoption and uptake that we have seen in the basic. The basic certification took a little while to get off the ground. It launched in 2019. Again, I keep mentioning COVID, but COVID happened beginning in 2020. It did give some clinicians an opportunity while they weren't in the clinic to take the test, to take the courses, and to pass the certification. But we're really working hard to build that. And we have some great groups that are looking at the certification and working on it now. Many of our training events actually result in certification. So the person will take the hybrid course, the online course, they'll do some in-person training, and then they'll receive the certificate. Any questions on that? So we talked about the certificate at the individual level, but we also have an opportunity for courses to be recognized. And recognized courses then can lead to a person becoming certified. So we have our course recognition program. This is also overseen by the Professional Standards Board, which helped us developed the rubric to assess these courses. They can be online, they can be in person, or they can be a hybrid course. And we at ISWP assess the course content in English and Spanish. We have the resources to look at courses in English and Spanish right now. So those are the types of courses we're able to recognize. Upon completion of the assessment, the course receives a recognition and a symbol that they can use in their promotion materials and advertising their program to attract students. So it has been a very good promotional opportunity and a validation that the courses that these universities and training centers are using can count toward a person's certification. And we're really pleased that we have 6 courses in 6 countries recognized as of March. The University of Montreal was the first course recognized. So for a course to be recognized, you'd start with a form on the ISWP website, and then we would be following up with you from there. So our last P is people, but as you saw in the WHO system strengthening, that is our focus. So we always make our focus the end user, but we also focus on our providers because they are the ones that make the difference in the lives of the wheelchair users. So as I mentioned, we also have a foundation in research, and we are very pleased that ISWP team and our partners have produced 23 papers as a result of this grant-funded project. We had a special issue of the African Journal of Disability, so some of those 23 papers were published there. As part of the USAID funding, we actually piloted the development of strategic plans in Romania and in the Philippines. And we thought that if we can develop a framework for wheelchair service provision at a country level, we could perhaps adopt it in other countries. So it was a great test case. We haven't moved further at this point from the 2 countries that we tested. As you can imagine, it requires time and resources to do that. But when ISWP is ready to take that on, we certainly have a good framework to work from. We also have partnered with an open access research source called ADDEP. It's the Archive of Data on Disability to Enable Policy and Research. And it's US based, but it certainly welcomes international studies. We currently have 4 studies from 9 countries that are housed there. You can go to ADDEP, that's a lot of letters, .org, and type in ISWP and you will see the ISWP specific studies. And you upload the data. Of course, they'll check it for human subject appropriateness and validity. The team at ADDEP scrubs the data, and it could be a good basis for you as you are working on an advocacy campaign or you're looking for validation for one of your programs or proposals. So we have 4 studies from 9 countries. We hope to continue to grow that, but it is a great resource overall for assistive technology and wheeled mobility. And our outreach extends to all of you. You know, we have spoken at almost 100 conferences since we launched the grant. We have a very robust social media following. Our newsletter serves almost 9,000 people. And then we talked about the resources here today, the policy advocacy toolkit and the wiki and the website and the online courses. We really have developed these resources to make them open access, free to you, and as usable. And we're always looking for feedback. We had a great session yesterday, which Sarah led. We had her leading a discussion on the online courses, and we got a lot of good feedback on the navigation of the courses online, what worked, what could be improved. So we are always looking to improve these experiences. So please let us know. So in summary, we're really pleased that ISWP has been making and continues to make a big impact in the wheelchair sector globally. We have an enthusiastic group of over 100 volunteers that partner on these initiatives. We have wheelchair manufacturers and suppliers who engage in really interesting discussions about the appropriate products and product standards to test wheelchairs. And a lot of great work is coming out of that and continues to come out of those calls. We have a warm welcome from service providers. We see a continuing growth in the number of requests we're getting from organizations that need help with training. And they'll use the online modules, and they'll ask for our suggestions for trainers in country who can support them. So all of this is really elevating the wheelchair sector worldwide. And it's all complemented by our hub for resources, excuse me, that include all of the items that you've seen here today. So I'll stop there and invite questions. I know I've been doing a lot of talking, but I welcome your questions or comments, thoughts. Are we missing something? I'm sure we are, but yes, Jeremy. Yes, thanks. The question was, have we considered recertification? So you get the certification, how do you recertify? Yes, we do have a basic wheelchair service provider needs to be recertified every 2 years. And in that, as part of that recertification, they need to undergo 6 hours of continuing education over a 1 year period. They also need to submit a letter from their supervisor saying that they have been engaged in wheelchair service provision. So we do have that as part of the recertification process. In the intermediate certification, it's new, but an intermediate service provider would be recertified every 3 years. And that involves continuing education as well. We realize that intermediate providers may not see those more sophisticated cases as often. So that's why we have the Professional Standards Board allowed a 3-year certification period. And the trainer certificate is a 5-year certification. And in each of those cases, in addition to the continuing education, they need to provide a letter from a supervisor providing evidence that they have indeed conducted that level of service. So thanks for the question. Any other questions or comments? Mary? Mm. Mm-hmm. And those webinars are actually recorded. So if you're not able to participate in the day and time that they're held, you can go back and listen to them, and just note that it's self-reported certification hours. We don't track it through a third-party system, but we rely on the certified provider to provide that information when it's time for the recertification. Yes, Dana.
I think you had mentioned that it is downloadable, so it can be downloaded and then shared with people with less connectivity.
Absolutely. Yeah, we strive to make sure that all of our resources are downloadable and easy to use. Many of our clinicians, and I'm sure many of you know this, but they're relying on their mobile phone. So if they can't get it through their mobile phone, they might be able, or they don't have strong internet connectivity, they can download it and watch it offline. So we strive to have those accessibility of resources. So thanks, Dan, for that. Other questions? Yes. Well, I'll turn that over to Alex.
And that was supposed to be one of the activities that we were going to do, but I think that we're running out of time. And I think that this might be a nice point in the session to actually ask you, what do you think, now that you've seen the suite of resources that we've curated, and we don't want to just keep developing new resources. We don't want to just, we want these things to be out there, and we need your help to be able to spread the word and to be able to connect. So I'm probably going to put the question back to you to say, what do you think we should be doing or focusing on? What should we focus on less, and what should we focus on a bit more? I think there has been a paucity of data and research into the activities and the lack of resources available, which is why we've invested so heavily in all those academic research papers and presenting, because we needed to create the energy and show that there is a need for a coordinating mechanism like ISWP. So now that we are here, I think the focus will be less on doing those research and academia, but trying to get to implement and trying to be more relevant and noticeable in countries, but not from an ISWP international sort of level. What I would like to see, my vision, is for in each country and definitely in each region to have people like yourselves that take the activities and become ambassadors or champions. But yeah, maybe if I could put that back to you, Karthik, and say, well, what do you think?
I'll repeat again. I mean, I can only speak from Australian perspective. We have a National Assistive Technology Alliance, similar to RESNA you guys have here, and ARATA is another peak body for assistive technology professionals. And for rehab engineers, there's a National Committee on Rehab Engineering. So I think, yeah, there needs to be a lot of people, learning about this and seeing the value in it. So we could spread the message a little bit more, I think, because we don't hear about it as much as you would like to, probably. Yeah.
Yeah, and I think from my perspective, this is an international organization, so I think we need to get more representation, we need to have more diversity, and we need to be, I think, as an entity, a little bit more inclusive. I think the hard work has been done to create and build this. And now that we have this organization, and Eric, I'm going to come over to you, because I think that from the perspective of the end user, how can we maybe engage with people like yourself a bit more?
So I'm going to say that as a wheelchair. Sorry. So as a wheelchair user since 1984, I've been around for quite some time. And what I've seen, and I'm just not going to mention this specifically regarding what ISP is doing, but in general, a lot of the things that people are basing on is laboratory, and the laboratory and the real world is not the same thing. And so much of this positioning is based on stuff that I think is actually wrong. And it's because somebody did some testing and then they came to a conclusion, and they're not getting real wheelchair users to see what they're actually doing. And I think that is one thing that is missing in this entire industry. And I think the wheelchair users really need to have more of a say as to what is going on and what is being developed. So that doesn't really answer your question, but I think that is a whole in general. And I think it's an important thing to get out.
Super, thanks, Eric. Yeah, I think there's food for thought for us, and definitely I think the direction of travel has to be more engagement. I mean, we heard, was a Chaz in the opening plenary about being more inclusive and including diversity, equity, and inclusion into what we do. And I think this is part of what you're trying to say, is that we need to be more incorporating into everything that we do at ISWP moving forward. But just for everyone here to know, as you know, we've been incubated under the University of Pittsburgh. So the rest of this year, there's a lot of administrative tasks that have to be done. We've got to transition the founding board. We've got to, the website, for those who in Sarah's session would note that there's some issues that we need to fix. We've got to invest some time about that. There's a lot of advocacy. There's a lot of planning. So I think you'll see a little bit less of the developing of any new resources, but trying to get these out to people. But there's a lot of administrative work that we've got to do to make this organization sustainable and to grow. I'm going to pass you back.
I know our time is up, but Eric, I wanted to address that point. The ISWP founding board now has a formal governance structure, its bylaws. So we will be recruiting members to vote. But I wanted to tell you that the founding board made sure that the composition of the board includes wheelchair users and their caregivers and families. That's specified in the bylaws. So we know from the AT system strengthening that people are the focus of what we do. And the ISWP founding board has made sure that that is the case by making sure that there are seats on the board. I mean, that sounds like, okay, a seat on the board, but I mean, that's just the starting point to make sure that we do hear and we are respectful of the needs of the wheelchair user and the caregiver. So we realize that this extends beyond the user to the caregiver and the family. So I wanted to let you know that the board made sure that those are encoded in the ISWP bylaws. Any other questions? Well, we'll have to forego the group activity, but that's okay because we're here as your resource. So keep in touch with us, email us, register on the website, call us. We have all this technology available. We want to hear from you. We need to understand what you need in order for us to help you succeed. So with that, I wish you a great rest of the day, and let's hope the rain does not. We've had a great couple of days, but hopefully you'll enjoy your last day here at the conference. And thank you again for all that you're doing for wheelchair users worldwide.